Hi, everyone. My name is Kelly Fitzgerald, and I work for a lobby firm in Richmond, Virginia called Alliance Group. Before coming to Alliance Group 8 years ago, I worked for a nonprofit organization that had programs and did advocacy for patients with rare and chronic diseases. And now in my job at Alliance Group, I also still almost solely work in the healthcare space with different types of healthcare clients. Some of those are patient advocacy groups like the Every Life Foundation. I'm your contract lobbyist in Virginia, and so still very much in the same space. And that's been really my life's work so far. So I'm really excited to be able to talk with you guys today. This is one of the things that I really enjoy doing is speaking with people about advocating. It can seem very overwhelming and seem very big if you've never done it. And a lot of times, if somebody's a first-time advocate and we're at a kind of a training before a lobby day, kind of ask people, how are you excited? How do you feel? And they're like, I just don't know what to expect. And they're very, very nervous. And it's always great to talk to them at the end of the day and say, how was it? And almost invariably, they say, they're just normal people. I'm like, I know. They are. So I think it's always a good experience for people because politics and politicians can, again, seem like they're not us, but they are. And they work for us. They work for you. And so when you walk into that room and you're there to talk to them or you're, meeting with them outside, they're there to help you and your needs, but it's about you getting there to tell them because they don't know if you're not there. And then also I'll just mention too really quickly housekeeping. Everything I'm going to say today is my own opinion and information. It does not reflect any of my clients. So we always like to say that as a disclaimer. So we'll go ahead and move on to the next slide. So I think as it's kind of, we talked about everybody on the call, I think most people haven't lobbied before or done any type of advocacy. If you have, that's great. Some of this might be kind of old hack information, but hopefully, it'll be some new too as well. Everything we're going to talk about, I wouldn't necessarily say that anything is non-traditional. I would say more that, again, if you're not used to doing it, if you're not used to being in the space, a lot of times people just aren't aware of all the opportunities and ways that you can advocate. There are some that are very forward facing that we're going to talk about and you're going to talk about later with your oral and written testimony, but there are a lot that are not forward facing. And that's the really nitty gritty relationship building part that is so, so important. And so we're going to talk a little bit about that. So if you're a person that's just getting started with advocacy, obviously Every Life is a wonderful resource. The staff there are fabulous. They know their stuff. But if you're, hoping to get more involved on a personal level and you want to be on the ground and active in your state, the biggest thing that I hope I can leave you with, because I believe everybody's from kind of all over the country, is that every state is very, very, very different. So what we're going to talk about are some methods and some ways that you can get the ball rolling and get more comfortable, but you're going to have to tailor all of these things to your state. At the nonprofit that I used to work at, I covered the federal level. So I worked in DC. I lobbied on the original Affordable Care Act and many, many other bills. But then I also at the same time covered multiple states. So I worked probably 22 states over the course of that tenure. And so again, I can tell you every single state is different. So these are some questions to kind of help get you oriented, to your state, because those differences are going to help you with timing and knowing when to do things. So some questions you should be asking yourself. Who are your members? So in the state that you live in, who's your senator? Who's your delegate? If you don't know who those are, you can go onto your state website and put in your address, and that'll tell you who your state representatives and your congressional representatives are. If you don't know that, that should be your very, very first step. When are they in session? That's really important because in a state like Virginia, we're only in session for 45 or 60 days. That's it for the entire year. It alternates those two timeframes every other year. That's it. In a state like Pennsylvania, you're in session all year. Now they take breaks, but that very, very much changes how things happen. So find out how long your state's in session and when it is. What committees are relevant to you? So there are committees of jurisdiction, and when a bill gets filed, it gets placed into a committee. Sometimes it gets moved around afterwards, but hopefully they get it right the first time, and it's in the right committee. So if you're doing healthcare work, there's sort of, two things you want to look for in committees. In every state, there should be some type of healthcare committee. In Virginia, it's called Health and Welfare and Institutions. But if you look on your committee list, something should say health in the title, and that should point you in the right direction. The second committee is actually more of an insurance committee. So it's in Virginia, it's called Commerce and Labor. The reason that's important is because health insurance in most states is not in a healthcare committee. A lot of times it might be in a different type of committee. And obviously, as we're talking about healthcare and access to healthcare, health insurance is going to be a huge part of that. So those are a couple committees you want to be looking out for. Again, in every state, they're going to have a different name, but it should be enough to kind of get you pointed in the right direction. The budget is also a really good place to get started, to kind of see. In every budget, it'll have a healthcare section, that state agency, the healthcare agency in your state, and that'll have a budget. And a lot of programs like newborn screening, like things like sickle cell programs, free mammogram screenings, all different types of health programs are a lot of times run out of your state's health department budget. And a lot of times we need more money going to those budgets. So those are places that you can be looking. But again, try and familiarize yourself with the names of those committees. And again, who's on the committee, who's the committee chair, the name of that member. If your member that represents you sits on one of those committees, that's what we call gold. That's amazing. Because they have a direct voice on that committee and can specifically speak to you. So that's really amazing. Are there groups already working in the space? So sometimes you don't have to start from scratch. There might be other advocacy groups already working on the same type of issues that you care about. And in that case, it's really great because a lot of times there'll be larger coalitions, and you can kind of piggyback and join a coalition if you'd like to. And it's a great way to meet people working on similar issues. It's a great way to network, learn more about what's going on, lean on people. We have a lot of coalitions here in Virginia where, we really help each other out. It's, hey, did you see this bill? What does this mean? And we, even professionals like me that do this for a living, we help each other out. So coalitions are also a wonderful, wonderful place to get started. And those aren't just for lobbyists. Those are also for people who work for nonprofit organizations. Those are for individual advocates. So there's a lot of opportunities there. What is the political makeup? So that's really important too. Obviously different political parties have different agendas, different things that are important to them, but also have different ways of getting there. So it's important for you to kind of see the political makeup of your state to know whether they're going to be fighting at loggerheads about how they want to get somewhere, or if you're going to have, a House and a Senate that are, let's say, like Virginia, both Democrats. That helps a lot. Because they're both talking to each other. It doesn't mean they're not going to have any disagreement, but it means that there's probably going to be one agenda that's moving forward. They're not going to be fighting each other all the time. Divided government is a good thing. It is a good thing. But I'll just tell you, when we had a Republican House and a Democratic Senate, it took 9 months to get a budget because, unfortunately, and something you'll encounter as you start advocating more. Unfortunately, right now, things are very, very polarized, and they're very emotional, and it's just something that you're going to encounter. And so sometimes that can kind of cause too much consternation, and you never get to that goal line of really helping the everyday people, which is what they're there to do. When are the elections? That's super important too, because in an election year, they're going to be busier than normal. Also, is this person's seat up? Do you want to support them, or do you want to support someone else who you've established a relationship with and you think might be a better candidate for you? Is that going to change things about what the legislature is going to look like? And when you have a specific ask or a specific bill, knowing those types of things can also really help to say, hey, maybe this isn't the year, or wow, this looks great. We should absolutely push for this year. So those are things to think about. Is there a rare disease council? So several states, I don't know exactly how many, but several states, and Virginia is, I think, 2 years in, have rare disease councils. And those are, you have to pass a bill to create them. We have one. It's very, very new. I know there's a very active one in Pennsylvania and a couple others. But there are citizen slots on that where you can be appointed to sit on that just as a parent or an advocate or a person who themselves has a rare disease. So there's opportunities like that. There's public comment at those meetings. You can sign up if you'd like to speak or say something about something they're looking at. And again, you can just listen in. And the idea for that is, again, for everybody who's like-minded, works on these types of issues, that they get together and you can have a spot where you can all talk, share ideas, and hopefully get some progress. And what are you trying to accomplish? So whenever you meet with a legislator, you always want to have an ask if you can. Obviously, a big part of it is going to be you talking about your story and your experience and your challenges. And in the end, they're going to say, what can I do for you? What do you need? So it's also really important, even if it's something as simple as, can you help me meet the right other legislators to talk to and tell my story to, so that we can figure out a way to overcome these challenges or bring more support to me and my family or to the issue that we're working on. Even if it's something as simple as that, if you don't have, let's say, vote yes on HB 241, have an ask and have something ready to go, because they really like action items and things that they can do to help you. And we'll talk a little bit more about that in just a second. I'm trying to keep to time. But also, yes, I think I just switched those. But also, again, what are you trying to accomplish? So what will your ask be? Those are kind of intertwined. And then also federal or state. So sometimes certain challenges can be overcome with state legislation, should be dealt with on the state level, but sometimes it's more of a federal issue. So a lot of times, or you might have to do both. So a lot of times you'll have an issue that's come up, and again, I'll use health insurance as an example. So certain types of health insurance policies, let's say you're at a really large employer like Amazon. That's what we call a large group employer. So your type of health insurance policy is governed by a federal bill. So you could pass a state bill, but it's not going to touch that insurance plan. So it's really important to understand what you're trying to accomplish, but what's the best way to get there. So if there is something, again, you might have to do both. If you're passing a state bill that has to do with health insurance, that you're only in Virginia going to touch about 24% of the market. The rest of those health plans are governed by a federal bill. So those are also really things to keep in mind as you're kind of looking into what you want to do, but also as you're talking to legislators. So next slide. So once you've kind of asked yourself all those questions and you feel like you really want to get started and you have a good enough lay of the land that you want to dive in, then you've got your tool belt already, because you've asked all these questions, you've started to meet people, and now you're kind of ready to go. So my ideal that I tell everyone is that your member that represents you should know you on a first name basis. So my old boss, Jim, at the nonprofit that I worked at, he lives about 45 minutes south of DC, between Richmond and DC. And there was a Republican member, chair of a committee, and he was their constituent. And so, and obviously this was sort of through work, but also he's a hemophilia advocate. There's hemophilia in his family, many generations. He's been advocating for hemophilia for a very, very long time. So he's, he would, skip class in college at Mary Washington and go to DC and lobby on certain bills. So he's been doing it forever. But he didn't have a relationship with a specific member. So, he went ahead and spent $50 to buy a ticket to a fundraiser that he was holding. And tickets can be that low. You don't have to pay $5,000 and also obviously you can just send an email, but ways to talk to them off session. And he said that member was so annoyed because he would not leave him alone. And he was like, I don't care. And so Jim kept going back. And after a while, he started inviting him to his Christmas party. And after 3 years, he came. And they're on a first name basis. They know each other. Jim's at another job now. But that definitely, it's not always about testifying. It's not always about having these, again, big forward facing moments. It's about those times where you can interact with them, where they're not talking about a bill on a committee, and you establish those relationships. And it was funny. He said every time he saw him coming, he would make a beeline, and Jim's like, nope, we're going to say hi. And finally they became friends. So, that's kind of a way to meet people. Again, meet with them. You can send them an email and try and schedule something. You can do a Zoom meeting. But again, it's really important to think about the state that you're in. So in Virginia, because our session is so short, it is best to go meet with them first off session. So don't try, if there's a lobby day, sure, but I would not recommend trying to schedule the very first meeting you've ever had with your legislator in Virginia during session, because they just don't have time. So it's really important, again, to figure out those little things about your state, to know that, wow, I should go try and meet with them in May and June and July. That's a great time. Go to their events. They all have websites. They have Facebook pages. Some of them have Instagrams, and can't say Twitter, it's X now. But they might have picnics that they're doing, or they might say, hey, I'm going to be at the oyster roast, in Rappahannock on Friday. Come by and say hi. You can come by and say hi, shake their hand, tell them you're a constituent, talk with them. Even if you're not a constituent and you just want to meet them because they're on a committee of jurisdiction and you want to form that relationship, go to the Oyster Festival. So they put a lot of that stuff on their newsletters. A lot of them have weekly newsletters that you can sign up for. If you go on their website, it'll say subscribe here. And again, they'll tell you their schedules a lot. There's a legislator in Chesterfield here that every Friday morning from 9 to 12, he's at the Egg and I, which is a breakfast restaurant. He sits in the same booth, and it's an open house, and anybody can come by and say hi. So as soon, the more you get to know people and familiarize yourself, they want you to come talk to them. They want you to tell them who you are and what you need, because they don't know otherwise. Couple minutes. Be a resource. So let's say, say, hey, if a bill comes up during session, I don't have an ask right now, but now that we have a relationship, if a bill comes up about rare disease and you're not sure, call me. I can either talk to you about my experience or how this bill would affect me, or I can put you in touch with the Every Life Foundation and they can help and get resources to you. So give them something too. Tell them that you want to be a sounding board to say, wow, this bill would be terrible for me as a patient with a rare disease. Or, again, as we're in the newborn screening space, anything like that. Tell them that you'll be a resource for them. Volunteer. You can volunteer if they have a campaign. You can volunteer to send out leaflets, make phone calls. And obviously that's a little more in the campaign space. But again, there are opportunities to volunteer that also can help you develop those relationships. Invite them somewhere. If you're having an event, give them an award. Give them the Healthcare Member of the Year award. They don't even have to have done anything. They don't even have to have done anything. You can give them an award. They love that. But inviting them somewhere, and then also, kind of saying, hey, also we'd love to give you an award. Those are also ways that you can, kind of have them come to your space. And again, action items. Hopefully, if you can have somebody, if you have that kind of, ask at the end, that's also really great while you're talking to people. I would also say, I talked to a couple advocates who said they've had trouble getting through on email to different members. And when they've sent me their emails, I'm like, well, send me your email. Let me kind of see what it looks like. So they sent me their emails and they definitely go into their full story in the email. I wouldn't necessarily suggest that. What I would say is keep very kind of concise. I would say, hey, my name's Kelly. I'm a constituent of yours. I live here. I, work here. I went to this high school. And I happen to have a rare disease, or my son has a rare disease, or we had, this. And we have a lot of challenges that we're dealing with. I'd love to set up some time to meet with you to discuss more and tell you our story, talk about those challenges, and work with you to try and overcome those challenges, see what we can do in the General Assembly to do that. So I wouldn't necessarily go into your full story on the email. Just kind of keep it very, hey, very concise. I'd love to set up some time to meet with you. And a couple of them sent that email and had a lot better luck getting in with offices. And then I just have a minute. And then, like I said, I would say get creative. So, like I said, none of these are necessarily non-traditional. They're all just not your maybe regular forward-facing things. In Virginia, we don't have time for a 10-minute oral testimony. Our committee meetings, you'll have 42 bills on a docket, doesn't even start till 7 p.m. You get 3 minutes per side if you're lucky. Sometimes you get 3 minutes total if they're in a grumpy mood. That's total. So if you're in a state that has time for a full hearing, that you've got 3 weeks notice, hey, you've got a physician, you've got a patient who's willing to give their oral testimony. There are some states where that is absolutely the norm. You have those opportunities and you should absolutely take them. And it's going to be some great information just in a second if that is an opportunity for you. In a state like Virginia, though, we don't have that opportunity. You literally, it's about you physically being there and saying, hi, this is my name. I support this bill. That's the time that we have. So in Virginia and other states like that where sessions are shorter, if you don't, again, it's about the relationships. It's about the time you put in getting to know those members. It's the time you can come to the General Assembly and they recognize your face. There's like, oh, that's the rare disease lady. I'm telling you, members, they come to know advocates because they're there all the time. There's a lady in Virginia who has worked in autism for 25 years. She passed a sweeping package of autism legislation, I think about 8 years ago. And every single legislator knows her. Every single legislator knows her because she spent the time down there and they got to know her face. They got to know her as a resource. And she's still working on things and also with some other rare disease groups now. And she was just an advocate who did that. So I would say, again, get creative, get down there, get FaceTime with people. And I know it's daunting. I know it feels overwhelming, but they're just people like you and they need to hear from you so that they can know what they can do to help you. So I hope that's been helpful. And my contact information is right here. And thank you so much for having me.